says all panelists. Okay, I apologize.
That was awesome. All right, because radiologists make way too much. Yes, that's true. Janet Young, on Duwamish land in Seattle, healthcare should be a human right. This is true. This is true. Why the hell isn't it? Okay. If it's okay with you guys, I'll introduce myself. My name is Mariana Everson, and I'm honored to serve on the board of Whole Washington as the vice chair. I'm a registered nurse, and I serve some of the most vulnerable among us who are in a mental health crisis. I'm married to an Air Force veteran, and I'm the mom of 6 beautiful, mostly grown children. And I've been fighting hard to win on healthcare, not insurance, for everyone since 2015. Welcome. We're here because healthcare is a human right, and too many of us have been denied healthcare for too long. And we know that the time is right now for us to fight and win healthcare for everyone. I'd like to do a land acknowledgement. Myself, I'm grateful for the hospitality of the Chehalis tribe, and I live adjacent to the Quinault Indian Nation and in connection to the Chinook people who still fight for national acknowledgement to this day. Please type in the chat where you're living and acknowledge the indigenous people of those lands. Maybe we'll read some of those after a few minutes. We want to offer our sincere gratitude for you. All you do to help us win on healthcare. Just by showing up today, you're taking action to bring us closer to healthcare justice, and we know this is a fight worth waging, and your contributions to this fight mean a lot. If you've not updated your volunteer form, please go to wholewashington.org/volunteer and do that. Also, raising money to print petitions. So if you go to the website, wholewashington.org, there's a couple ways to donate, and you can buy yourself your own beautiful red beret. That would help a lot. We have tonight a lot of important information for everyone that we feel is imperative that people understand as we look at how best to move our state and country forward in the delivery and financing of our healthcare in our current and in the post-pandemic world. We're looking forward to hearing your questions and answering what we can so that we can all make informed decisions regarding our societal role in financing universal healthcare. Now, I want to introduce you to our contributors to this town hall. We're so excited to have Senator Marilyn Chase. She's been instrumental in helping us to develop the I-1600 into a full-fledged implementable bill that continues to offer us, and she continues to offer us advice and leadership in our lobbying efforts to our legislature as a valued Whole Washington board member. Senator Chase herself is one of the few senators who has ever introduced single-payer legislation for the people of Washington. And she did this long before finding us in such a critical time where essence that we chart a different course in how we pay for our healthcare in Washington. Senator Chase served as a state representative for LD 32 from 2002 to 2010 and a state senator from 2011 to 2019. Jason Call has a 30-year history of progressive activism. He's a husband, a father, a former public school math teacher, a musician, and a progressive activist, and a candidate for Congress. Over the last few decades, he has stood up for working class values around war, healthcare, education, and our environment. Jason serves as a member of the Whole Washington Board as well. Catherine Lewandowski is a registered nurse who's been caring for our community for over 30 years. She is the Whole Washington Board chair, a wife, a mom, a grandma. Catherine has served as a union leader in her local nursing union as the local unit chair and negotiating team for many union contracts. She is dedicating all of her free time to working for Medicare for All here at the state level, and to be expanded into national, expanded and improved Medicare for All. Rhonda Walker is the chair of of Our Revolution Washington Bernie Kratz Coalition, the founder of Showing Up for Racial Justice in Southwest Washington, Cowlitz County State Committee member, elected PCO of the Washington Democratic Party, Whole Washington volunteer since the launch, and one of the organizers of Bernie's rally in Tacoma last year. She's a proud supporter of her 4 children she's been lucky enough to raise. Her focus is on anti-racist organizing and believes that ensuring healthcare is truly available to all is a must. Next, we have Leah Perkle. She's a wife and a proud mother of 2 college graduates. She serves as a state committee person for the 49th LD and elected precinct committee officer in the Washington Democratic Party. She's active in her community. She was elected a national Bernie delegate and a Bernie captain. Her husband, Steve, is the reason she's so involved as a volunteer for Whole Washington, whom she feared she would lose to a major health crisis not so long ago. Her Jewish faith is very important to her as she serves as a board member for AWRJ Women's Group, and she's worked on several local candidate campaigns. Noelle is a member, I'm sorry, let me say the last name. Paiki Rhodes is a member of the queer, Hawaiian, Jewish, and BIPOC communities. She serves as an executive secretary of the Washington State Democrat Disabilities Issues Caucus and is a proud Whole Washington volunteer, as well as a writer and a founder of M-Dashes, a small collective of working women writers. Her book, The Fire Principle, can be purchased from dreampress.net, and her next book, A Government of Bees, is forthcoming in 2022. You can find her on Sundays and Mondays at the Whole Washington General Meetings, and Sunday she gets the host. Please welcome all today's contributors. First, we'll hear from Catherine Lewandowski, our board chair.
Okay, I'm so sorry. I'm going to kind of let Noeo get a little bit caught up there, and I was answering a question. Yeah, so all right. Anyway, I want to thank everybody for attending. We really appreciate it because we feel this information is so very important for all of you to know. We want to talk about the economics of subsidizing a healthcare intermediaries. These are the people that stand between you and your healthcare providers. The benefits we are discussing and how we evaluate effective health policy depends on our basic understanding of how our healthcare system as an economic system works. So this chart from the Washington Office of Financial Management, just published in August of 2019, shows that in 2017, 54.1% of over 4 million of Washington's population already had public funded coverage. The majority of them are covered by Medicaid and Medicare already. All of these areas are not mutually exclusive. And so if you added up all these numbers, they actually total like 61.77%. But there are people like me who have 2 sources of coverage, such as employer-based insurance and TRICARE, or like my husband who has VA and employer-based insurance, or VA and Medicare. But in this graph, the employer-based insurance is all government employees, such as your local and state governments, who have to provide healthcare for their employees. But the main point of this graph, though, is that it shows that the majority of public funded healthcare is via Medicare and Medicaid, and the rest is just a very small percentage. Next slide. This second chart from this report, the same report, depicts our current delivery system of healthcare from providers to consumers as of 2017. It's kind of hard to get more numbers that are going to be accurate, any more current than that. It shows the number and percentage of population in public funded coverage in Washington. Again, the percentage of healthcare in 2017 that was paid for by taxpayers is 54.1%, while the percent of healthcare that is paid for by employers is 40.4%, and that adds up to 94.5%. So in order for us to move to a single payer, comprehensive universal healthcare system, such as option A, as was recommended by most of our state's own Universal Healthcare Advisory Working Group, and as what would be provided by passing our Senate Bill 5204, which was our bill introduced by Senator Bob Hasagawa, creating the Whole Washington Health Trust, first in 2019 and again in 2021, we would only need to cover an additional 5.5% of our residents. At that time, that number was a little over 400,000 of our residents. And I think the number is a little bit higher now, but it changes every week. Also, please remember that the Universal Healthcare Advisory Work Group's own actuarial studies estimated option A to save our state $2.5 billion a year and the first year, and over $5 billion in successive years over the other two options that they evaluated. Next slide. This is the most recent information that I could find from a report from the Office of Financial Management here in Washington of what's been happening during this year of COVID. And I think there's some really interesting occurrences here. It was published in early April of this year. In May of 2020, that was 2 months into the shutdown last year, the uninsured rates increased from 8.1% before COVID-19 to 57.8% by May of 2020. And before COVID, the number of employees with employer-based insurance was 65%, and it fell to 13.3% by May of 2020, 2 months into the pandemic. There was not a lot of change in Medicare coverage or military or VA, which makes a whole lot of sense. But then looking at March of 2021, it is very interesting to note that where 61% now had employer-based insurance again, the uninsured is down to hardly nothing, 0.8%. And there is a huge increase in those on Medicaid, up to 63.2%. Now, I'm glad that these people now have health insurance coverage, but what we need to realize is that those people had to lose most of their worldly assets in order to qualify for Medicaid. And you can also see that there was a significant increase in the number of people who are purchasing individual policies on the exchange. Sadly, these are people who are currently using up all of their assets, trying to survive during this pandemic and economic crisis. I think it's important to remember also that these are our friends, family, and neighbors who've been working their butts off since the Great Recession of 2008 to try and recover from their losses that occurred then, also through generally no fault of their own. So I'd like to pass on to Leah so she can talk about our accounting and system and tax policy. Are you there, Leah?
Leah, could you unmute, please?
Okay.
Sorry about that. Hi, Catherine. Thank you for that introduction. Hi, I'm Leah Perkle, and co-pays are the profit center of this system, and every provider has their handout. This only adds to the healthcare expense paid by regular citizens and interferes with the regular citizens seeking early care. Due to lack of funds, more and more are living paycheck to paycheck. Due to fear of unknown potential healthcare costs, people are afraid to see their doctors, making early diagnosis of controllable diseases less likely. Providers, networks, physicians, pharmacies, pharmacy benefits managers, radiologists, sorry about that, administrative data work. All these middlemen are trying to skim dollars out of our system. And it's much easier for them to accomplish that in complicated and convoluted systems rather than in a streamlined system that single payer offers. State legislators, lobbyists, and representatives, all their expenses are fully deductible, including campaign donations. We really need some accountants to explain how the equity investors are able to write off as business expenses, such as lobbying committees in the legislators, and reduce the claimed profit in their bottom line, thereby continuing to pass the tax burden onto the taxpayers. We believe that in our society that healthcare is a human right. It is not a product to be delivered, but rather a social service that we collectively agree to provide to every person because of their inherent value as a human being and as a guarantee to us in our Constitution of the United States. And now I'm going to pass it off to Rhonda Walker.
Thank you so much, Leah. We're going to talk about draining the surplus, the profit, as a business expense, reserves, and surplus. So insurance carriers are holding excess reserves to be invested rather than being used to reduce premiums to purchasers. They are keeping 4 to 10 times their legal requirements of reserves. They are moving surplus from state to state. In reports made to the Washington State Insurance Commissioner, the insurance carrier, Primera, transfers millions of dollars in surplus funds to reputed board members of companies that own Primera. These surplus funds are being transferred to equity investors who then invest our premiums, and yet we don't receive the profits from those investments in the way of premium reductions or increased benefits. When's the last time your insurance premiums went down or your benefits increased? Those profits, though, are going to overpaid CEOs and the shareholders whom they are accountable to. Let me repeat, while our citizens are going bankrupt or dying because of the cost of healthcare premiums, co-pays, deductibles, and other uncovered expenses, the health insurance industry is accumulating surplus dollars far and above legal requirements rather than expanding coverage limits or reducing premiums. Managing the regulations and the regulators, buying influence when crafting the regulations. Okay, so legislators author bills to guide or regulate the insurance carriers in the delivery of a product. So not government service, but a private sector project. Insurance carriers hire lobbyists to help them. Lobbyists succeed when they protect the interest of the carriers, so the health insurance companies. Lobbyists strive to become the go-to person for their economic sector. Lobbyists succeed when they control the discussion and the policy framework of the discussion. So lobbyists buy influence, that is their job. Their success is measured by the public policies adopted by the legislatures at every level. Public policies that overwhelmingly benefit the carriers, so your insurance companies, rather than the consumers, us. Thank you. I'd like to turn this over to Jason next. Jason, you ready?
Let's go. Our research has shown that over 2.5 million of our healthcare dollars have been funneled to our elected representatives who are members and chairs of their respective healthcare committees. These are the same elected officials who have refused to allow discussion of any other healthcare financing plans, both before and during an economic crisis and health pandemic. All of these dollars that are being used to influence our elected officials are coming from the healthcare premiums of our Washington citizens. Think of all the lives and livelihoods that could be saved with these dollars by providing healthcare rather than buying favors that benefit the health insurance industry rather than our Washington residents. Our elected representatives should be working for the benefit of the people, but through private sector financialization, our society has made the production of financial products more important than the delivery of healthcare to our people. Even during this economic crisis, they refuse to face the truth that our current healthcare financing system is a market failure. For them, the money is good, and maybe because they're part of the 54.1% that receive publicly funded healthcare, it isn't a priority for them. We do want to talk a bit about how our current I-1362 benefits our state's small business. All right, where currently they must compete with the larger corporations who are financially able to either negotiate lesser rates or participate in self-insurance with the potential for saving money or even making profit off the monies held in reserve. And we do want to clarify that these numbers are from our funding study that we have paid to have completed on our I-1600 initiative. It contains slightly different funding mechanisms, namely it had a 1% income tax that is no longer included. Whole Washington has again engaged Dr. Friedman to update his funding study with our current funding mechanisms, and we expect to have the results of that within the next couple of months. But generally, we can expect these things to remain true, where hundreds of millions of dollars are spent annually in shopping for insurance benefits to cover only 60% or so of our residents with the I should spell that out, with the Whole Washington Health Care Trust. All that time and money will be saved, and 100% of all employees and residents will be covered with comprehensive health care. And where most businesses spend an average of 18% of their payroll covering their employees, they will only spend 7 to 10% for platinum level of coverage that has absolutely no networks. Next slide, please. The top graph here shows our current healthcare system in Washington. As you can see, only 50% of small businesses with less than 24 employees offer health benefits, and only about 10% of businesses with less than 10 employees offer health benefits. This makes the bottom graph look very odd because it looks like those businesses with less than 10 employees will be paying much more in taxes than they currently pay for health benefits. But it's only because so many don't currently offer any benefits to their employees. In reality, they will now be able to offer benefits at a cost of about 7 to 10% of payroll, as compared to the current average of 20%, which most of them couldn't afford. And even if their employer doesn't cover them, their employees can still enroll individually into the trust. And I will hand off to Noeu now.
Noelle, you are muted if you're trying to speak.
Can you hear me?
Yeah, we can hear you now.
Okay, wonderful. Sorry about that. Just a little bit of a hiccup. I want to talk with you tonight about our initiative I-1362. Jason gave me just a few thoughts to go after, and I just want to continue building on that. For your knowledge, our initiative, which is based on our bill, includes everybody. Everybody's in, nobody's out. And that's kind of a tenet for whole Washington. But you can be sure that we have that backed up by graphs and things that are made by people in important places. But despite what this very important graph says, it's very simple. If you work here or you live here, whether you're undocumented or not, by virtue of just being in Washington, you are a Washingtonian, you're a resident. And you deserve health care. Just by being a Washingtonian, you deserve health care. And healthcare is very different for insurance. We're not increasing your insurance coverage like people in Olympia and Washington, D.C. want to do. We want to get rid of insurance. We want to provide health care because insurance does what they're doing at the top. That's our current system of healthcare, or excuse me, insurance, where people their money is taken away. It goes to the government, it goes to insurance companies and billing and admin, and it goes to hospitals, and it's taken away from you just to build insurance companies up and their admin and billing coupled companies. And it's just this huge web draconian system geared to take away your money and leave you hopeless and despair. Now, healthcare, as provided by a single payer system, would take taxes from businesses and people to the government, and the government will pay for your healthcare, and they'll be the only one who pays the bill. And the government will get the best price for the cost of healthcare, and they'll be able to give people livelihoods. There's a lot of talk about rural hospitals closing, and with our plan, that's just won't happen. The hospitals won't have to close because they will be able to get paid for what they need. And the middleman, like we talked about before, will be out of the picture. So all of those side costs will go away, and people will be able also to keep their jobs, because enshrined in our bill and in our initiative is job creation for those who lose their jobs because of this plan. But I don't want to get away from this. When we talk about numbers, people are like, oh, well, the numbers. The numbers are great. But I want you to look at healthcare as a public good. Healthcare simply must be done. It's like the education we provide to people. It's like the firefighters that we provide. It's like libraries. It's a public good that makes society have public wealth. And when you have public goods, you create wealth in people. People are able to spend more time with their families. They're able to spend more time vacationing. They're able to take a load off at the end of the day because something more is taken care of. And we need to be the first in the fight to provide these kinds of things for people in Washington and in our country. And that starts with enacting public goods to create public wealth. And in whole Washington, we have a saying, we like to believe health is our wealth. And it's time to start investing in our innermost cherished natural resource. And that's each other. And it is my pleasure before I introduce our last speaker for the night, I just want to talk again about I-1362. You're going to see people around collecting signatures, sign, because we need your signatures. We need a whole lot of them, and we need to bring them to Olympia this December with 430,000 signatures. And we're going to take those signatures to legislators, and it's going to force them to make a decision. Either they're going to pass our bill or they're going to pass on it. And it's going to go on to the people to make a decision. And when the people make a decision, and I know they will pass it into law, and I-1362 will be enshrined in law, and there will be nothing that they could do about it. And we will move forward with our plans from there. But I know we have something special in our next speaker tonight. She's worn an amazing outfit, and she's an amazing person. I'm blessed to just have her presence here tonight. And I just want to introduce Senator Marilyn Chase.
Don't forget to unmute, Marilyn.
There we go. All right. Thank you, Noelle. That was a very nice introduction. I appreciate that. And I am pleased to see so many people here on the webinar. I think that it's an indication that we are riding the tide to success here. And I have just a few remarks that I do want to make. There, you've heard that people are talking about social services that we provide in the state of Washington, and we do because but whole Washington considers many of those social services to be human rights, and that includes health care, and it is a human right that is possessed by everyone. So with that, I want to say that oftentimes we blame business for the lack of coverage. But this blaming ignores the ultimate responsibility of the public for creating the conditions that let a business profit through hurting the public. We witnessed this intersection while we watched in the last few months, the last 4 years, between public leadership and big business, and in the response to the COVID-19. Or we could also add to that environmental disasters, things that require a more mature adult response by our by our public. And I believe the same thing holds for healthcare. And in the long run, you know, it is, did we lose it? Is everybody still there?
Yeah, we're here. We can hear
Still
you.
here.
Okay, well, I lost you, so.
We need this
Okay,
slide, though.
good, okay. In the long run, it is the public, either directly or through its politicians, that has the power to make destructive policies unprofitable and illegal, and to make sustainable policies profitable. When we consider healthcare policy, housing or other social services, or environmental policy or economic policies, through the actions of the politicians, we get the policies that our power as citizens permit. The healthcare system that the public has permitted in this country has components. You've got carriers, those are the like Premier and the people who do the carriers, the providers, the docs, the nurses, mainly the nurses deliver our healthcare, I might add, regulators, you know, people who make sure they're following the rules, consumers, that would be those of us who consume the healthcare, and policymakers. But they're all speaking double speak. They follow business accounting rules, service delivery rules, public administration accounting for the delivery of public services, and several levels of tax policies, in addition to the rules of business accounting. It is a deliberately difficult system to understand. And the only ones who can change this is the public. The public can change this. Bringing about the public acknowledgement that healthcare is a human right is a moral argument. Anthropologists tell us that throughout history, government regulation has arisen precisely because it was found necessary for the enforcement of moral principles. The conclusion that the public has the ultimate responsibility for the behavior of even the biggest business is empowering and hopeful rather than disappointing. Whole Washington is taking responsibility for providing health care for our people and to take it to a vote for all the right reasons. In the long run, it is the public that has the power, either directly or through our politicians, to correct this grave and unsustainable public policy. We invite everyone to join us. We appreciate that you're here at our webinar tonight, and we are ready to answer any questions that anyone might have. Thank you.
That's wonderful. Oh my gosh, you guys are great. All right. Courtney is our friend, and she's been monitoring the chat. And so we want to know, Courtney, if you would feel free to unmute if you found any questions in the chat during this that we can try to answer.
I have not seen any questions yet. Just some greetings and land acknowledgements. And
oh, that's lovely. Oh. Do we want to go through those? All right. Okay. I know that this is a webinar, so people are attendees in a webinar, so you don't really have the ability to come on camera if you're in the chat. So if you do have questions, I know we just gave you a lot of information, and if you do have questions, please go ahead and type it into the chat, and we'll do everything that we can to answer those questions. I'll give everybody a moment. I'm scrolling through the chat here, and I'm finding comments about Tommy Douglas, who brought healthcare to Canada over 50 years ago. People are here because healthcare is a human right. Woohoo!
Mariana,
Yeah.
I think what we're finding is that this plan makes so much sense, and we have explained it so clearly. It is so common sense and moral and correct that people really are just are floored here and don't have any questions. I think that is how good
Yeah.
this initiative is. This is gold standard.
Yes, it's very, very excellent. Thanks for everybody's work on this. This has been wonderful.
I would like to ask a question. Is that all right?
Yes.
All right. I would like to know how we're going to collect all of those signatures. Do we have kind of a plan that we can talk to people about?
We do. And it's a bummer that our campaign manager couldn't be here tonight, but I'm sure we could piece it together with the rest of us board members here. Catherine, do you want to start?
Yeah, everybody is starting to get really excited because we got our initiative number and our title and summary statement. So that is all getting worked on and going to be hopefully going to the printer on Monday. And people have been trying to get together. The number of people coming to our volunteer meetings on Sundays and Mondays has been just amazing. And then it is going to be difficult. We are still in a time of COVID, and there's not going to be a lot of big events. So we're trying to find as many as we can. We're trying to encourage people to be safe when they do collect signatures. But that I can't. I have to acknowledge that is going to be a difficult thing to overcome, and that's why we need many volunteers. Many volunteers to go out to the smaller events and collect the signatures and get them back to us. Luckily, that's the other reason we went with an initiative to the legislature, so that we would have more time to be able to collect the signatures that we needed. So I do see another question here too.
There's two questions.
Yeah, there's a few questions in there. Mhm.
Oh, there's many questions.
Courtney's our question person.
Yeah.
Yeah.
Court-
Courtney, can you ask questions, please?
It starts with thanks for your work. I'm just beginning to learn that one.
Yes, so we are needing a high level overview of how the trust would work and how it would be funded.
I can answer that.
Oh, please do.
So I have slides prepared for this. Because I come prepared for my meetings with slides. And it's pretty simple. But I'm not a numbers person. So first I'm going to give you the really complicated business. It's a lot. But we have a savings estimator that you can go to at the bottom of this slide, wholewashington.org/savings-estimator, where you can actually put in what your different numbers are and figure out how it's going to cost for you. And you'll be able to tell just how different it's going to be. You'll pay this versus paying what you pay now, and it's most likely going to be less, and you're going to get so much more. But there are numbers, and I like to take it as the employer share. Oh wait, don't go away. The citizen share and the investor share. Are they going to come back? Nope, they're not. Of course they're not. Well, let's show
Maybe
you from
they'll
here.
stay.
So the employer share, they pay 10.5% after $15,000, and it's paid kind of as a benefit for you. And then the investor share is capital gains tax 8.5% after $15,000 made. And they don't go after your home or your retirement. They just go after stocks and bonds, but some bonds they don't go after. And then the citizen share, which is based on the federal poverty level, household size, and age, and that is between $0 and $200 a month. But you're never going to be paying much more than a few if you're young, single, and you are not making a lot of money. You're not going to be paying a lot of money. And again, we have the savings estimator for you to go to. But that's how we all are paying our taxes. I don't know if there's any other ways of funding that we have going in there. But that's how I answer it on my meetings.
Cool. Next, is there another question, Courtney?
Yes, sorry, I'm going back and forth and I was muted. So there is a question about how we can continue to help grow this initiative for collecting signatures. And can we go in a little bit more about how the legislature could still pass the original bill and how we can put what folks can do to put pressure on that avenue at the same time?
Ooh, Marilyn, you'd be great for this question. Could you answer that one?
Well, the legislature, will not be in session until next January, and I think we're going to have our signatures in by that time. The legislature certainly could just go ahead and pass our initiative, and that would be it. We would have single payer, and that would be wonderful. That would be wonderful, but that's not going to happen. That's why we are going to go to the public, and the legislature has the option of proposing their own bill if they want. That could happen, and then they still have to submit both bills, our bill and the bill from the that they come up with, to a vote of the people. We'll see what happens there. They cannot ignore it. That's the beauty of this. This cannot be ignored. There has to be some action taken. And that's why it is so important. I've got a commitment to get 1,000 signatures. And that's going to be very, very hard. But I believe, that is something that if we all are out there gathering these signatures, I think we're going to get a lot of people to help us, and it will overcome the reluctance on the part of the legislature. Now, if you listen, when you listened to my remarks, I talked about the fact that the people are the ones who have the power, either the people or through our elected representatives, the politicians. It would be nice if our elected representatives would at least give us a hearing, but they chose not to. And so this is the kind of way, this is the way that we exercise the power of the people, and it is really quite wonderful. So I hope everybody will be out there grabbing those petitions, getting them filled out, exercising our power.
Yes, definitely be vaccinated first if that's what you choose. I will encourage as a nurse for that protection before you're out in public. But you can definitely get a petition and have people that are in your germ circle sign it, and then send that back. So that would be another way to help out. All right, Courtney, what's the next question?
We have a question about how Full Washington will engage with Veterans Health Services and the VA.
I want to answer that.
Yeah.
I want to answer that.
Yeah, do it.
I'm echoing. Because my husband gets service from the VA, and I think it's wonderful service, actually. And right now, the VA would be separate, and they would not be part of the whole Washington Health Trust. But the trust is instructed to attempt to ask for all of those types of federal coverages to be included in the trust and to receive those monies. That will be a whole lot easier if Ro Khanna's Senate bill, right now it's not Senate bill, HR 5010 from last time, he's getting ready to reintroduce it, the state-based universal healthcare plan. If that were to be passed by Congress, it will be much easier for us to do that. Our plan is not dependent on that happening, though, because we aren't truly a single payer plan. We still people will still use those other benefits if they have those, and those benefits would be first, and we would be secondary if they chose to enroll in the trust. But we will definitely, the trust is instructed in the language of the bill to make all of those requests and to try to get all of the waivers for all of those health systems that are currently both Medicare. What we plan on doing for Medicare is just becoming a Medicare Advantage, not an actual Advantage plan, and not a Medicare Disadvantage plan. So, and then they can come into the trust. We can receive those benefits just like the insurance companies do now. They receive all those medical benefits. And they would just go into our trust and we would administer them. So the plan is for us eventually to be a single payer, but the way our bill is written, it does not start out as a single payer plan.
So,
Thank you.
yeah, that's great.
Do you want another question?
Yeah.
I can couch it with some answer too. There's a question in there regarding outreach to local LDs and Democratic Party organizations. And there are better people, Noeo specifically, who are better suited to give you an overall comprehensive update on that specifically. We are reaching out to the local LDs and Democratic Party organizations. We are also reaching out to other organizations, DSAs, Our Revolutions, Indivisibles. So if you are in a group, get it to pass a resolution of support for whole Washington. Bring it to your body. And you can find a template for that on our website. So resources abound there, please indulge. And to expand a little bit on some of our initiative signature gathering plans, we are breaking in we're getting our leadership, county and regional leadership arranged. We are helping people organize within that space. We are documenting events happening that we can tell are happening in our counties and regions into a document so that we know what to plan and schedule for. And we are organizing the lists of people who have already reached out in asking us for petitions or pledging their signatures to us. So we do have plans. We also know that COVID has really thrown a wrench in things, but we do have plans, and we look forward to hearing more suggestions from new people. And I have to say, cannabis stores are a hot spot. It attracts both liberally minded people and healthcare patients. So you get a real good mix in front of cannabis stores. Targets are key. And then, so Noeo, if Noeo would like to give us an update on specifically the Democratic Party organizing, that would be great.
Oh, sure. We in outreach, that's the team, sub-team of volunteers in whole Washington. We have gone after a lot of LDs and a lot of different organizations. But these kind of relationships take a long time to make happen. So we have a lot of introductions, a lot of things like slated to happen in June or July, but we are thankfully going ahead. I think we'll have, if I'm able to get the 35th, which I've been just trying to get for 2 months now. If I'm able to get the 35th in a week or two, excuse me, we'll have gotten 10 different LDs their support. So that's 10 out of 49, right?
I'll be doing LD19 next weekend. So
Awesome.
yes,
If you want me to be there, I'll be there.
you're welcome to come. Yes.
Yeah, I will be there. I will, just to be in the seats.
And I've got people working on the 29th and the 27th and Pierce County as a whole.
Awesome. If they need help with a presentation, if they want me to present, if they want me to just show up and answer questions in the chat, we kind of are a one-stop shop kind of team. And we also are big into mentorship. So if you've never done a presentation in your life, but you see yourself up in the stars doing a presentation, just like these kids in their wonderful hats, if you see yourself doing that in the future, come to outreach. We will put you in front of a presentation board.
I'm gonna toot our horn down in Southwest Washington here. We've got some fierce people getting things going. So let's come on, let's go. I hear Courtney kind of saying they've got some going on. I'm ready for a battle. Who's in it with us?
Woo-hoo.
We have a question in the chat about what does whole Washington cover? So let's go through that like a little bit. We talked about how to pay for it, but what the hell are we gonna get for this, what we're paying for?
Comprehensive health,
Everything.
inpatient, outpatient, dental, vision, mental health,
Rehabilitation.
rehabilitation. It covers recovery. It covers for people with different addictions. It covers gender confirmation surgeries, and medicines, transgender medicine. It covers basically everything that you can think of that Medicaid would have been like, nope. They
Yeah.
cover it.
The thing that I was like super excited about, and hopefully it's still in the bill, but in when we did I-1600, when I learned that ambulance services was covered, I was like, that is massive for people, because there's so many people who like, nah, I don't want to go to the hospital, I don't want to ride the ambulance, because they know it's $2,000 minimum bill to their city or their fire department. So yes, that would be huge for people to know that if they're hurt, they can go to the hospital. And when they go to the hospital, they'll leave with no bill. I mean, it's like liberation, I think. It's like, I can actually take care of myself. What the heck? Sounds like a culture shift to me.
Can I speak on that matter of ambulances, Mariana?
Absolutely.
So as someone whose husband had a heart attack 2 years ago, I don't know if people are aware of this, but lots of times the ambulance is not connected to the hospital. So even though you have insurance, we were stuck with a $3,000 ambulance bill to get him from one hospital to another, because only one hospital did open heart surgery. We also got stuck with $1,000 out of a $1,200 ambulance bill to get him from the doctor's office to the hospital that was closest. So even though you have insurance, it doesn't always necessarily is your ambulance bill going to be covered, because they're not, lots of times, not connected to the hospital, and they're a separate entity.
So, Marilyn, one thing about the benefits to remember, it covers everything that's covered in the ACA that's considered an essential benefit. Then it is 100% covered. And there's It's a covered 100%. There's no copays or deductible. It covers your medications and prescriptions. The only copay for that is $250 max per year. If you choose to use a, not a generic, but a brand name, when there is a generic medication available. Other than that, it's covered. So.
Okay, so let me think about that for my insulin patients, my patients who are dependent on insulin. That's like $250 a month at the minimum. So imagine $250 a year. Oh my gosh, we will keep people alive. We will keep people healthy. We'll keep people out of the hospital. Oh my.
You know, people tell me, well, how could we really afford all that? And it's because we don't really have an understanding of the amount of profits that are going to the for-profit health insurance industry and to big pharma. The state of Washington, Dr. Gerald Freeman has said that we are about the same size as the whole VA system across the country. So the state of Washington should be able to negotiate contracts with big pharma and get the same amount of savings that the VA gets, which is about 40%. And see, the thing is, what would you do if we added $5 billion a year to your home budget? What would you do? We really have no concept of how much money that is and how much money is in the system that they're taken off the top to basically fund denying us services. You know, sometimes, I don't know if people know, but sometimes when you go and you try to get a referral or whatever, they don't even look at it. It just automatically goes into the denial bin. And it isn't until a person objects the second time that takes it the second time that they actually look at it, because they figure there's like 70% or more that won't ever, they'll just say, oh, they won't cover it. I guess I can't get it. Anyway.
All right, durable medical goods. Yes, Linda, good question. Yes, it's covered. Your nebulizer, your oxygen, your walker, your crutches, but all those goods, yes, they're covered with this health trust. Everything you need to get better is covered.
Really?
Or stay well.
Really?
Really.
Oh my gosh. That
Yes.
means something to me.
Oh.
I know.
Somebody
Amazing.
asked a question. Oh, sorry.
Oh, yes, there's a question. Are you talking about the capital gains question? There's our capital gains tax
Oh,
is additional.
I did see that one, and I don't know if I'm not positive on the answer to that question. I'll have to find out, to be
What's
honest.
the
I
question?
think that it's
How is our capital gains portion, how is that going to interact with the current capital, maybe Marilyn knows, the current capital gains tax that was just passed by the legislature?
I might have an answer.
Oh,
It should be confirmed. But it is my understanding, based on discussions in our board chat, that it is in addition to what is being implemented outside of our bill. But that our bill holds a lot of exemptions. So we won't be taxing the sale of your primary house. We won't be, we won't be taxing the sale of your retirement business. So we have allowed for as many exemptions as we are legally allowed to make sure that the right people are paying the right amount.
and it's also, I know ours only goes into effect once a person once their tax is above, or once their profit is above $15,000. And that is like 5% of Washington population. And we know who those people are, don't we?
Our friend Jeff.
Yes, hearing aids.
Jeff. Marilyn, did you have anything to add to that capital gains
No, I
question?
was going to say, Courtney, that was a good explanation. You did well. That was good. And I would add that it's probably going to go to court, so it'll be a court decision. They will be fighting our capital gains tax because they don't want that in there. They knew it was in there. We're not going to put it in there. But you know, we're going to the people. If the people adopt a 1362, it goes. You know, we will have our capital gates.
Thank you.
Somebody-
I
To re-
see a question
Yeah.
in the Q&A. Do you see that, Courtney?
Oh, no, thank you for getting that, but I will review some of the questions about coverage while you're pulling that up. Dental, hearing, hospice care, long-term care, all of that is covered
They're
as,
asking about alternative and naturopathic. Since you're on that, that's what that's about. So I'll let you keep going. But
Yes.
those are the two, alternative and naturopathic.
and that is, I do take partake of those services myself, and it's my understanding that if you are a licensed provider in Washington, you are covered. And stop.
Yeah. Correction though, on the long-term care. I don't believe we have language that currently is covering long-term care. There is language, there was, unless they changed it, and I don't think that we did when we updated it. Our original language was that the board that the trust board that is created would, after it was established, take a look at being able to add in long-term care. So if we want to get long-term care, we need to get Pramila Jayapal's bill passed. And we may be at some point, because like I said, we don't have any concept of what saving $5 billion a year, what we could really be able to provide. Maybe we will be able to provide long-term care, but we didn't put it in there initially because we didn't want to, sink just because we gave out benefits that we weren't able to afford. But we are, it's in the bill that they should look at that, but it isn't covered right away. For me, as is.
Carmela, yes.
Oh.
All right. Did we answer the question about naturopathy? And yes, we did. Okay.
There was a question about what happens with people who are on Medicare right now. I know we talked about the VA, but I don't think we hit the Medicare. I imagine the answer is much the same though.
Yeah, I can answer that one. You can, so on Medicare, you can just have straight Medicare with no
Supplemental.
subsidy. Yeah, that you have to, a Medicare Advance is what they call it, to be able to get vision and dental, and it's supposed to help take down some costs, which I haven't actually seen that happen. But anyway, so with Medicare, so this would be one that you can select Whole Washington Trust as your secondary, if I believe, until everything rolls into a single payer, which I'll say that I know many who will jump on that chance because it still is a big portion out of pocket you have to pay for this extra coverage, and you still have high copays, and anyway, there's not a whole lot of benefit. So you'd be able to choose that as your secondary. So ultimately it would take away your out of pocket that you're paying right now for Medicare. It would take care of those expenses, from my understanding.
Marilyn said, Karen, can you unmute Marilyn?
Mine, yeah, mine, that's my understanding too.
Also my understanding that some people might qualify for Medicare reimbursement of their Medicare costs.
Yes, they will, yeah. So like my mom pays 169, I think, dollars out of her Social Security check to the Medicare trust, and that money would be reimbursed to her because she's under 200% of the federal poverty line. So she would have dental and vision and hearing coverage along with all the other things that she needs. And she would have $169 in her pocket that she didn't have before, and no copays for medicine, or, I mean, hello, liberation. Okay. Would providers have to bill Medicare? What about those who don't accept Medicare? Well, if somebody's already on Medicare and they have a doctor that takes their Medicare, that won't change, right? Their Medicare coverage doesn't change. they will just have this additional insurance that pays for all the stuff that Medicare doesn't pay for, right?
And that means you could see a doctor that does not take Medicare because you are
That's right.
covered under the whole Washington Healthcare Trust.
That's right. Somebody says that long-term care and home-based services is kind of a deal breaker for the disability community. So let's find a way to address that, and then let's communicate that to everybody later on. Or is that a good way to go? Because
Well-
I answered in the chat that those services don't go away. Like however it's getting taken care of now, like if someone has Medicare benefits or Medicaid benefits, those won't go away right away, if at all, and we'll have time to fund it through the single payer that we want, right? So let's be clear. I do this a lot. Okay, let's be clear. We'll have the health trust, and people will still have their Medicare and Medicaid, right? Somewhere down the line, we will work and fight to get it so that we can bring the Medicare and Medicaid money that we get from the federal government into the health trust. And then we'll have this other pocket of money to continue to pay for long-term care, hospice, in-home care, and all of that stuff. So disability community will not see a change, will not see a degradation in their in-home care or long-term care services at all, but they will see an increase on being able to go to the doctor, going to the dentist, getting their hearing aids if they need them, paying for their nebulizer or their walker or their new wheelchair, or whatever that stuff is. There'll be more coverage than you have now, no matter how it gets paid, no matter at the beginning, the middle, or the ultimate goal. Marilyn.
I think that one of the things that we have not mentioned this evening is that Pramila's bill on Medicare for All is probably going to answer many of the questions and concerns that we all have. There's just no question about that. But the importance of our bill is that we will be able to prove to the other states, the entire country, that people want single payer. We want health care. And it will give Pramila a great boost in getting her bill passed, because ultimately we're going to have to acknowledge this is going to take a national solution. It will. If we're going to get if we're truly going to get health care for all, it means a national solution. But this effort that we are engaged in here is so critical. It is so critical because we can prove it can be done. And it's such a well-written bill. It is such a well-written bill, So, I when we start getting into the weeds about is something covered or isn't it covered, ultimately, we may have left something out. I don't think so, but maybe. And, and I certainly, quite frankly, want long-term care in there, but, I know it's in Pramila's bill, and so the more we can push here, the stronger we make that bill, stronger it becomes. So don't anybody get discouraged. This everybody's watching what we are doing. Everybody. So
We have the added advantage here in Washington State in that we are really going to be the big game in town when it comes to initiatives this year. The reason I think everybody, the board, we really had some solid and open and honest debate on whether we should do this year or we should wait another year. And we looked at 1 year down the road, 2 years down the road, 3 years down the road. And it really became clear to us that there was no better time to do this than right now. The reality is we still have a way to go at the federal level. Half the Democrats support it, a little over half the Democrats support it or say they support it. I mean, who knows when they're put to the test? We don't know. But I mean, you got to realize that half of Congress is Republicans, and they're not going to support it. So we've really got to get all House Democrats and all Senate Democrats on board with a Medicare for All bill. That's going to take an awful lot of work. But the biggest pressure that we are going to be able to put to them is passing it state by state. And so many things in our recent history even have passed state by state. Marriage equality. And we're working on, federally legalizing cannabis. I mean, we've got a dozen, 15 states or so now, and we're going to have more passing that. And sooner or later, we're going to reach that tipping point where the federal government is going to go, okay, we're going to do this. I mean, that's kind of how things work. We had today a story released for the first time that New Mexico has banned qualified immunity. That's something that those of us who are working on criminal justice reform have said needs to happen. Well, now we've got one state on the books banning qualified immunity. So it's going to happen. It's going to happen state by state, likely. And that's going to be the pressure. New York has got a good movement. California's got a good movement. There are other states that have good movements, and we're in collaboration with them, and we're helping them, and they're helping us. And it's a big team effort with single payer movement state by state. But how amazing would it be if Washington State was just like legalizing marijuana? Washington State becomes the first. Washington State is the first in so many things. Did you know that we're the first state to have the governor and both senators be women? I don't know if anybody knew that, but when Christine Gregoire was governor and Maria Cantwell and Patty Murray were our senators, regardless of your opinions, that's an accomplishment, and Washington State was right there leading the way. So we're going to do it again the same way, and we've got really a great plan for community outreach here with lots of regional hubs, lots of regional coordinators. So looking forward to this.
I want to put in my 2 cents, if that's okay.
Of course.
So I am disabled and I am in long-term care, and I am a volunteer for Whole Washington. And I also am the executive secretary for the executive board for the Washington State Democrats Disability Issues Caucus. And so I want everyone here to know that this issue being brought up is an important one. And I hear what everyone's saying insofar as, things are going to take time and we need a national at the same time that we have a state by state struggle for this moment in time. But I think that we have to be very careful about how we bring knowledge of our bill to the people. It's not single payer. That's something that I'm finding out tonight. And it's not exactly full coverage because it is leaving some people out. There's reasons behind it, whether you understand them or not, but it's not full care. And I think that we have to tell people the truth, that I think we have to be honest. But I also think that we can be honest at the same time that we lift up the struggle of getting to healthcare for all. Lifting up the fact that we are going state by state, lifting up the fact that this is a national struggle at the same time that it is a state struggle, and seeing our disabled friends as partners in that struggle, not people to tell wait and see. This is something that I'm going to be this is a new thumb in my side, and definitely not a reason to leave Whole Washington at all, but a reason to keep coming. Thank you.
Thank you, Noel. That was very valuable and important. There are 2 other questions in the chat. One I can answer, and it was answered in the chat, which is, can we collect electronic signatures? And no, we cannot. We have to get what is called a wet signature. ink on paper. And then our other question is about providers. How will providers be compensated and how is that determined?
Anybody feel comfortable answering that? Because I can if you don't, anybody else doesn't want to.
With the, what, signature thing?
No, not that. The
Oh, the
provider deal.
providers. Yeah, Catherine, you do the provider question, please.
Yeah, so according to the trust, the rules of the trust is that there's like three committees. There's an overall committee that administers the trust, and there's a financial committee that looks at the financing of it and such. And then there's a providers committee, and that is one of the things that they would do. Actually, I think the financial and the providers are together. I can't remember how it works, but anyway, because there's a citizens committee too, that the citizens will be able to go to if they have issues or problems, and they would be the kind of the organization that would, or the group that would be evaluating quality and such as that. But the providers would be actively negotiating reimbursement rates with the board of the trust. And so when we did our funding study back for I-1600, we estimated a reimbursement of 5% above Medicare. And that showed us that we would save $9 billion a year. It didn't necessarily say that, yes, that's what we're going to reimburse it at. It's going to be up to the providers, I think, for them to come to the trust board and say, this is what we need for reimbursement. A lot of them would say, oh, we can't make it on 5% above Medicare. But I think personally that they don't really know that, because right now they're getting a certain percent that have really, or a small percent most likely, that have really good insurance that may pay like 200% of Medicare. And then they have Medicare with its reimbursements rates. And then they have a certain number of people that are on Medicaid, which pays about half of what Medicare pays. And then they have a few people that come in, if they're, at least a lot of the hospitals do, the providers can say, no, get out of here, you have no insurance, but they can't pay anything at all. They have no way of paying. So this would make everybody paying at least 5% above Medicare rates. And that spreads it out evenly and gives them a much more consistent level of reimbursement, which to me, I think would make it a whole lot easier to do your annual budget. But I think it is very important, because I have worked in negotiations and stuff for those providers to be there negotiating and proving this is why I need to be reimbursed this amount for whatever. So that will all take place through the provider and the main board.
Yeah, and I'd like to add that physicians groups and hospitals will be able to negotiate for a global budget as well.
Yes.
So that means they say, okay, we need X thousands of dollars every month or every year to run our clinic or our hospital, and then they negotiate that with the trust. They get that amount of money, and that's how much, they just deliver the care. They don't like make bills. So people who are in the billing department, or people who work in administration in that way, they can be financed to go back to school, because I'm a nurse like me and Catherine, because we're going to need more nurses to take care of all these people who have health coverage. So that would be great, right? And then someone asked in the chat about talking about it as Medicare for all might not be the best way. So we don't make that decision about what to call it, because people sometimes think that Medicare isn't perfect, and we know that. That's why we want to do this, right? And what Pramila's bill that she calls Medicare for all is expanded and improved, so that it would cover all of the stuff we're talking about tonight, and some stuff that we aren't covering in terms of the long-term care. Not covering yet. But her bill would cover, medical, dental, hospital, vision, health, mental health care, reproductive health care, all the stuff, right? Eyes are part of your body. Did you know that? Teeth are part of your body. Did you know that? Anyway, it would cover all of that stuff, and it would have this low payment, this low amount that we're talking about for our bill, where it's no more than $250 a year for this. And, you pay 4.5%-ish tax to the Medicare system, and you don't pay anything else, right? You don't pay anything else. So yes, the wording of Medicare for all can be, confusing or off-putting to some people, but that's what they call it, and we can't change that. So what we call it is universal health care or single payer health care.
And to comment on the, that it's not technically single payer, the way I categorize it as is, it is as close as you can get to single payer while remaining within, federal law. So the thing that prevents it from being full single payer, and this is why at this point only the federal government can actually provide single payer, are the ERISA laws from 1974 that allow employers to buy healthcare. So just to clarify, our bill makes it onerous on employers to not opt in. Employers who don't opt in are responsible for all out-of-pocket costs that their employer-based healthcare plan may not cover. So if you take an employer that is subscribed to Premera, they use a Premera plan, and Premera denies benefits, the employer then, because they have not opted into whole Washington, the employer then is responsible for those costs under our bill. It is far more advantageous economically for employers to opt in than to remain out. So while there is this ERISA federal law, and that is what Ro Khanna is trying to take care of with his healthcare bill, is to allow the states individually to get a waiver from these ERISA laws. So if Ro Khanna's bill passes, then what we would have here would actually be real single payer. But in the absence of that, we are, I say, as close to single payer as we can possibly get at the state level. And I think it is, when people have that question about single payer, it's a minor, I think of it as a minor detail, that the way the bill is written actually clears. I mean, you would have to have an employer with a really good and really affordable healthcare plan for them not to want to buy into whole Washington.
Yeah, they probably pretty much have to pay you to have health care for it to be better than this, which we kind of do pay people to have health care with the Medicare reimbursement, right? All right.
And then there was one other question. Leslie in the chat had wanted to go over again what Noeo had mentioned about not everybody being covered. So can somebody go over that again with the long-term care, because this does affect the disability community, and it is extremely important that we keep that in the forefront of our discussions on how we move forward here.
The thing is, I think what people need to understand is that right now it doesn't cover long-term care. It just covers medically or essential benefits. So if you had to go to a SNF or a skilled nursing facility after your surgery, it would cover that. But just for residential care in a long-term care, it doesn't cover that. But if a person qualifies for Medicaid, because Medicare currently does not cover that either, okay? You have to be on Medicaid to get those services. So if we were to get, or that's why while we are becoming a single payer, we will still have those people covered with Medicaid getting those Medicaid service. If we got the waivers to be able to take care, administer the funds for those Medicaid patients, we would be obligated to provide the same services that they currently get under Medicaid. Okay, we can't get around that. So they would not lose any kind of benefits at all. And so I guess I was probably incorrect saying we don't cover long-term care, because we would cover those that were medically necessary to recover from a surgery or to go through rehab, that kind of stuff. But we don't, there isn't anything to cover residential long-term care until you start qualifying. But eventually it would be there.
Well, but I have to pay $700 a month to live where I live in long-term care.
That's your participation fee. And
Yeah.
I don't completely exactly understand all of that, why they make everybody go through that. It just makes things more complicated, in my opinion, because basically, you're paying 713 and then they're getting more from Medicaid to cover the difference, but why they don't just give the provider all of that, I don't really understand why they do that at all.
Well, what I mean is that in a just system, disabled people would have an income and their home fees would be paid for.
Right, because right now, I think you're allowed like $70 a month or something ridiculous.
I get 30. I get 30.
Yeah, didn't they just like reduce that? It was like, really?
Yeah, and I think that there are many other disabled people in long-term care who would like, to have an income.
Yeah. So this gives us a way to fight that for-profit system, right? That takes all of your income and makes it so that you do not have control of your financial freedom, right? So this bill, this way of organizing our healthcare, gives us the power to change that.
Right.
The power to change that. And there's no other way to change it. So, I mean, that I know of. So this is how we do it. This is how we make it happen. Because and I know, I mean, I don't know where you live, Noelle, but I know that my father-in-law passed away this year, living in a skilled nursing facility. And because he needed that care at the end of his life, due to his health status, he lost every single penny of everything he ever owned in his life, right? He had, a place at the lake. He had his primary house. He had another house, and he had a truck, and I mean, he just all the things he accumulated by working a union wage job his entire life is now completely gone because he had to pay $6,000 or $8,000 a month to stay at this long-term care facility, this skilled nursing facility. We are going to change that. We are going to change that. He should not have had to work his entire life to just give that money. It does not cost $8,000 per patient to provide the care that people need in a skilled nursing facility. It doesn't cost that much. It doesn't cost $6,000 every time you turn on the CAT scanner. It does not cost the hospital that much money. So this is how we fight that, right? This is how we make it cost what it costs. And we move that savings on to the people, not to the profit center of the, Wall Street Exchange Corporation. We pass that savings on to the people. And I think I have been told, in the way I've read it, we could reduce premiums for people with the overtime with this whole Washington Health Trust. So say you're paying the maximum $200 a month, right, as your premium. Over time, we could make that go down and increase the benefit. I mean, is that life-changing to you, or what? That we would get more coverage, more care for less money? It's mind-boggling as Americans, I know it, but we can do it, and this is how we do it right here. This is how we do it. So please sign up to volunteer, to gather signatures, join a team in your county, in your city, in your LD or wherever you go on vacation. Hey, I just got tickets to the Dave Matthews Band concert at the Gorge at George for the whole weekend, Labor Day weekend. And me and some friends are going to go there. Courtney and Rhonda and my husband and I are going to go there, and we're going to work the line, baby. Work the line at the Gorge. We're going to work the campsite. We're going to get lots of signatures over 4 days of being at the Gorge. So be creative. Think of ways that you can get in there and get the signatures. It's super fun. And people are clamoring to sign it. Like even 2 years ago when we did this before, 3 years ago, people were like, yeah, let me sign that. Let me sign that. It's going to be even better now. It's going to be even better now. People know that their employer-based health insurance can just go away at the blink of an eye, and they could be not covered for anything and be in the middle of a pandemic with no health insurance. So this is how we win, guys. This is how we win.
So I think we're out of questions in the chat. It is a little after 8:30 now. So just want to throw that out there. And I will say at the beginning of this meeting, when we were going over the charts about the differences in health coverage between 2019 or in previous years to May of last year, like my 12-year-old was agog. They heard those numbers and were blown away. So this isn't hard to understand that healthcare should not be tied to employment.
A 12-year-old can figure it out. We ought to be able to figure it out.
I
Amen.
agree. Thank you all.
I had a quick question. Courtney, you missed my question in the chat.
Okay, put it on the chart.
Ask it. Ask it.
So, okay, so as a Washingtonian, my doctor is in Oregon. If I once this passes, do I have to switch over to a doctor in Washington?
No.
Thank
You-
you.
Just
They can bill the whole Washington Health Trust like they do Blue Shield.
Might
Okay.
I suggest one thing? I really recommend that everyone read the bill. It's only, there are 3 sections there, and it's really well written. It's well laid out, and many of your questions would be answered.
And if you read the bill, those of you in the audience, you will be better educated than your legislators who are refusing to read the bill.
Refuse.
You
And
mean
believe-
like my state senator in the 49?
That's exactly who I was
Oh,
thinking
yeah,
about.
like that one.
You mean the chair of the health committee in the House?
Yes.
That's in the 34th. We're talking about in the Senate.
Oh,
No,
Senate.
I gotta go.
yeah,
Yes,
missed
I
that.
live in the 49th, and my state senator, who's on the healthcare committee, will not support it.
she's
That's
the
right.
chair of the healthcare committee, and she
Yes,
won't,
she
and
is.
she would not only not support it, she won't read it.
I was like, yeah,
That's-
she
that's the
hasn't read
thing.
it to my
She
knowledge
won't, she
either.
won't even read it. But that's
All
what
right,
you
all right,
get
all right.
when you have a background in hospital administration, I guess.
But she does. She's making big bucks. I gotta go cook, guys. We got big family thing tomorrow.
Yeah.
thank you.
Happy
Good
Mother's
night,
Day to all
everybody.
you moms.
Oh,
Been a
happy
pleasure being
Mother's
here.
Day
Thank
to
you.
too.
Great work,
Bye,
team. Thank you.
everyone.
Don't forget to sign up
Bye,
to be a
everyone.
volunteer at Whole Washington. The link is in there. If you have any questions, reach out. Love y'all.
Y'all did good.
Washington
Thanks.
Health Board.
Good night.
Good
Good
night.
night.